final segment of the Safe Injection Practices Review addresses emergency response following vaccination. Anytime a medication, including a vaccine, is administered, the person administering must be competent to address an expected or unexpected response. Clearly, making the patient comfortable and engaging them in the vaccination process can go a long way in preventing responses such as anxiety and fainting. However, in very rare instances, a true emergency may occur following a vaccine administration. There are specific steps that must be done, and this short review covers only a few of the highlights. Every individual involved in medication administration should be certified in basic cardiac life support. In addition, every facility should have specific policies and procedures outlining emergency response. The following algorithm is one first-step approach. At least annually, every facility should review and practice their emergency response plan. I want you to pause and take a look at this algorithm and determine its usefulness in your practice. Let's talk about our take-home points. So our final group of take-home points involve those relevant for emergency response. Anyone can have a negative response to a vaccine or any other medication. Those responsible for vaccine administration must be trained to quickly and correctly recognize and address an emergency following immunization. Each individual should review the local policies and procedures regarding emergency response at least annually, and more frequently if it makes you feel more comfortable. Be prepared for the most common response following vaccination, which include fainting or nausea. Often this is due to a vasovagal response or holding one's breath and bearing down during the vaccination process. Having your patient talk with you during vaccination or take slow, deep breaths may help prevent this response. If your patient demonstrates any other more serious responses, including shortness of air, difficulty breathing, complaints involving the mouth, tongue, or throat, or other symptoms aligning with an allergic reaction, promptly initiate your emergency response plan. This may include oral medications such as Benadryl or injectable medications such as epinephrine. In addition, calling for emergency medical assistance should be included early in this response. Outline your emergency response processes and keep copies available for reference and review. Practice your process regularly. If you have had to initiate an emergency response, perform an after-action review to see if there are opportunities for improvement anywhere in your process, from vaccine handling through administration. Thanks for your participating in the Safe Injection Practices Review. I hope that you've learned something through each one of these segments. I hope also that you will think about how you can incorporate this into your practice, not just one day, but every day. Remember, your patient depends upon you to provide them with ideal care, best practice care, and this is your opportunity.